When I go on a trip, I gotta get a lot of reading done. And this was the case this time too. And I actually read a couple of different studies regarding an older drug, been around years and years and years. It's a cardiac medication used for the heart. In a higher dose, it's used for supraventricular tachycardia, meaning your heart's racing, it slows your heartbeat down. It also, old time, before we had a lot of the new drugs now for heart failure that we have now, it could be used for heart failure and heart disease. We have better options now, and that is digoxin, the generic for Lanoxin. This is actually a plant-derived drug, kind of cool. But one of the things about this drug, it has a narrow therapeutic window, meaning if it's too low, you're not getting the good effects of the drug. If it's too high, you're getting the adverse effects of the drug, and it's not a big window there. You've got a real small area before you go toxic and before you're therapeutic, which is why when you start this drug, they'll draw your blood probably a couple of times, and then if you're on this drug long term, they'll draw it at least once a year. Senna S. This will actually increase levels of digoxin, so you could see the toxic effects from it. Another one, Miralax or polyethylene glycol, will actually decrease the levels of your digoxin. So you want to be aware of that. If you're on it for heart palpitations and you're still getting them, or you started this and notice you're getting them, or only when you use this, if you're using it as needed and you notice those palpitations, talk to your doctor. You may need to do something else for constipation, like prune juice, water, maybe some magnesium. But be aware of that because, as I say, a lot of older patients are on laxatives as well as this drug if they have heart conditions. And if you're having issues, don't hesitate to reach out to your provider to get a blood level drawn.